Hello everyone. This video is going to be a quick overview on the basics of documentation. It's going to cover the purposes, we're going to go through the SOAP note format, and then just talk a little bit about really the science and the art that needs to go into appropriate documentation. There's a lot of information in your book. You have exercises you're going to be working on, so as I said, this will be just a quick overview. So when we look at the purposes of documentation, I don't think it's any surprise to you that communication is one of the main reasons. You're going to want to read what the physical therapist has written in their initial exam and evaluation. They're going to want to read what you've written about the patient regarding the day-to-day treatment and their progression toward their goals. Other healthcare providers are also going to want to read what you've written. At the hospital setting, for example, where I practice, the physicians are very interested in knowing how close people are to being ready to go home, because discharge is always important. The social workers and the care managers want to see what the patient can do to see if we recommend them not going home but going to a skilled care facility. You're going to want to read what the nurses and the physicians and other people write so you know the medical status of the patient. So there's a lot of communication between healthcare personnel. We also need to communicate with insurance companies. They want to make sure that we are providing the care that we've contracted to give their patients, and that there's a reason for skilled care. And we're going to talk about documenting skilled care and making sure that we're showing the skills of a physical therapist and physical therapist assistant are really necessary. A medical record is a legal document, and I'm sure you're all aware that there are privacy rules related to that. You can't just share that information with anybody. In addition, if there would ever be any kind of legal action or somebody is suing another person, this information that goes into the legal document is going to be part of, can be subpoenaed, and it's part of a medical record or part of a legal record. So it's really important when we go through the different requirements, accuracy is really important. I think one of the most important things really about documentation, especially going through the SOAP note format, is that it's a great way for you to organize your thought process. And you'll see that as we go through, you're getting information from the patient about the patient. You're documenting information about the patient that you've measured. You're clarifying what you want to do with the person, what you have done, what their response is, and then looking at their progression toward their goals. So it's really a very logical flow. And regardless of what format you use, the documentation process should be a way to reflect and to assist your thought processes. Utilization review is something that facilities do to make sure that the services that are being provided to the patient are appropriate, that they're needed, and so they are going to look at your documentation and make sure again that there's justification for the skills of a physical therapist or physical therapist assistant. So the other day when I was at the hospital working, I saw a lady, and she had just had her gallbladder out, elderly lady, 85 years old. She ambulates with a walker. She really isn't quite safe to do it by herself, but she also didn't really need the skills of a physical therapist. So I set up a walking program with the CNAs, the nursing assistants, to walk with her. And that was the appropriate thing to do. It wouldn't have been appropriate for a physical therapist or physical therapist assistant to provide her skilled treatment, as she really didn't need training with her gait. She just needed supervision as she is recovering from her surgery. Another element that you may have heard of is continuous quality improvement, where we are always trying to make our processes and our patient care better, and so often reviewing documentation is a way to measure different elements. Peer review is something that happens when a peer, another therapist, assesses how well you're doing on your documentation. And again, I have this done every month when I'm from the hospital, so if someone else, another physical therapist or sometimes an occupational therapist, goes through, make sure I collected all the information I was supposed to collect, make sure I reported correctly, I billed correctly, and I just did everything that was required. So this is very common and typical thing that you can expect, that someone else will be reading samples of the notes that you write. And then finally, reviews of medical records are often done for research, particularly for retrospective studies. In other words, they'll go back and they'll take 1,000 people who had their knee replaced and they'll assess the amount and type of physical therapy they had done to see what their outcomes were. So that's another example. So those are all the many purposes of documentation, and we'll touch again on some of those as we go through. We're going to be talking about SOAP notes. Really nothing to do with soap, though hand washing is very important. SOAP is an acronym. It stands for Subjective, Objective, Assessment, and Plan. So I'm not crazy about the word subjective. I think it implies that the information coming from the patient isn't as accurate or as trustworthy or as solid as the information we might collect. But this is the word that we're stuck with. But it's information about the patient that's important to their physical therapy care that we get from the patient. We could also have this information from a family or a caregiver. So if the patient comes in and says, boy, those exercises I did at home really made my knee more sore, that would be something to reflect. Or the patient's wife might say, I noticed they're a lot more steady when they're walking across the lawn. Those are all things that you could reflect under subjective. And there's a whole list in your notes and in your reading about other things that you could put in the subjective section. But basically it's any information you get from the patient, family, or caregivers. Objective really has two main things in it: the results of the tests and measures and the details of the treatment. So you are collecting data on a variety of things. We've just recently been doing goniometry. Can you tell what motion this person is measuring? I hope you said hip external rotation. You would be correct. So we are collecting data very frequently, and so any data collection we do is going to go in the objective section of the SOAP note. In addition, we are providing a variety of interventions often, and so the details of those, patient position, how long we did the treatment, any particular response to the treatment, all that type of information would need to be collected and go into that. And again, there are many different types of treatments we do. So as you are learning more and more treatments, this is one of the things we'll ask you about during your checkoff, is what information would you put in the objective section of your SOAP note. Probably one of the more challenging areas for everyone to write, and certainly for new clinicians and students, is the assessment section. So for one thing, for the physical therapist, after completing the initial examination and evaluation, they need to come up with a diagnosis. So you might think that the patient comes to physical therapy if they're referred from a physician with a diagnosis, and sometimes that's true. But the physical therapist is responsible for coming up and either verifying or coming up with perhaps an alternative diagnosis for the patient's problems. Often, you may be aware, people just get sent to physical therapy for knee pain or shoulder problems. Those aren't really diagnoses, those are symptoms. So the physical therapist needs to figure out mechanically what's going on. The physical therapist assistant doesn't do diagnosis, but at the end of every treatment, they need to write a clinical impression. In other words, an assessment of how they think the patient's progressing or not progressing. So an example would be, the patient is improving, as noted by the increased strength and more independence with gait. So logically, I should be able to look back into the objective section and find the details about strength, because that would be data collection, and the details about gait to understand what this phrase means. So this is a summary phrase of things that particularly you would find the details of in objective. We need to find develop a prognosis, and this is often where we justify why they need skilled therapy and kind of where we think the person's heading. So the skilled physical therapy is needed to improve their strength and gait so the patient may return home alone. And then finally, if we have suggestions or ideas that we think might benefit the patient, that they would go in assessment. And then plan. Two main things that go into plan are the goals and the treatment plan, the activities. So the goals are what the patient will accomplish. The three elements of the goals have to be functional, they have to be measurable, and they have to include a time bound. So by when will they accomplish this goal? You have a supplemental handout that goes through this, but as an example, a goal related to ambulation, since you're working on ambulation right now, would be the patient will ambulate 150 feet with a front-wheeled walker with supervision in 1 week. So the function is the ambulation with the front-wheeled walker. Measurable is 150 feet, and also the supervision level, and then time-bound is in 1 week. So those are the three elements of the GAID, and you should look at that supplemental handout for other examples. The other thing that goes in the plan is how you're going to accomplish those goals. So what you accomplish versus how it's going to happen. How are you going to do that? So sometimes students get goals and plans mixed up, or goals and interventions, because there's time elements and they seem kind of similar. But in the goal, there's no mention of how you're going to do something. There's no measure of the gait training or the strengthening or anything like that. That's what goes in the interventions. So the types of treatments, manual therapy, strengthening, therapeutic exercise, etc. How often? Once a week, once a day, twice a day. Length of each session sometimes is required, sometimes we don't include that. And then certainly the overall length of treatment. So the patient will be seen for 2 weeks total or 4 weeks total or whatever it is. So there should be some logical connections between the goals and the interventions, but they are separate statements. And then there's a variety of other things that you could go in the plan section. A really common one would be equipment they might need, or if they're going to be referred. So remember in the previous one, in assessment, I said that they would benefit from referral. What's different about that is that's the opinion. So that's why it goes in assessment. If I'm doing it, I'm going to refer them. That's a plan. So again, that's a subtle difference sometimes that people get a little bit confused on. As far as the standards, again, there are a lot of information in your book or in the notes, but I also gave you another handout called Defensible Documentation Elements that was produced by the American Physical Therapy Association, and that's in your supplemental handouts. And we can go through that more when we're in person if you have questions, but I know you can read. And basically, we want to make sure that we're being complete, and if you fill out everything completely in the SOAP note format, you will have met all the standards of documentation. Anytime we enter into a medical record, some of the really basic things, we have to be accurate, clear, and concise. Remember I said it's a legal document, so definitely accurate and clear are important. Concise, because you don't have a lot of time to do this, and people don't have a lot of time to read, the great American novel, so it needs to be fairly straightforward. And this really applies whether you're writing in person, on paper, or if you are writing into an electronic medical record. One thing you have to remember is, regardless of format, nothing ever disappears. Once you write something, it's there, even if it's completely wrong. If I've documented into the computer thinking I was writing in one patient's record and I was in a different patient's record, that note never really went away. I just wrote an addendum that said, error and what the error was that I entered into the wrong medical record. But that never actually gets deleted. On a paper record, you draw a single line through an error. You don't scratch it out, you don't use whiteout, you don't erase it, you just write a single error so they can still see what the word or words were, and then you just write that it was an error and initial and date that above it, and of course write correct information below it. So the idea is that they don't want any evidence down the line at some point that there was any tampering with the medical record. And really the reason for that is because it would be suspect that there was some error on the part of the medical personnel covering up something. So let's say a patient was given the wrong medication, and then later the person who gave that medication went back and fixed the medical record to make it look as if the patient was given the correct medication. So that's why things never go away in the medical record, whether it's paper or electronic. These are some tips. A couple I want to focus on. One is the use of abbreviations. Every facility will have a list of approved abbreviations, and that's kind of waxing and waning over time, but I would say the trend right now is to use very few abbreviations. We, where I practice, just recently got a new list, and there's hardly anything on it, because the idea is that non-physical therapy people reading notes don't understand the abbreviations and don't have time to look them up or don't want to look them up. So I think abbreviations can be beneficial. They can help you be concise and quick with your documentation, but it does not always lend to clarity. So that's the issue with it. And so you really need to make sure that you are using approved abbreviations in whatever facility you're in. You definitely need to do number 9, which is demonstrate skilled care and medical necessity. And so skilled care has to do with showing that there's the level of clinical decision making and the problem solving, why it's important, why skilled care instead of unskilled care is necessary. So again, when I was going to walk with that older lady, I did it the first time to make sure everything was stable. I didn't need, that person did not need the skills of a physical therapist to practice her walking throughout the day. She just needed some supervision for safety. And that was able to be provided by a much lower skilled personnel, a CNA. So every time we see a patient, we have to document why the skills of a physical therapist or a physical therapist assistant are required. So overall, if you think about going through your SOAP note format, you're taking in the S what the patient says, in the O you're taking observations and data you've collected, combining that with your observations of their response to the treatment. You pull all that information together in A, the assessment, come up with your clinical impression of how they're doing, and then in the plan you reiterate goals and the plan or the need going forward. So what you'll want to do at this stage is just be able to go through that assignment I gave you. You are welcome to work with other people, and I want you to be able to take the statements I've given you. There's a series, I don't know, of about 25 statements, and you have to identify whether each statement should go in the subjective, objective, assessment, or plan setting. And then we'll talk about that in class. All right, thanks a lot. See you soon.